Hi everyone, Rachel from North Brisbane, psychologist here. Today I'd like to share with you a brief self-compassion or self-awareness, self-understanding exercise that I sometimes use with clients. For me, it's like a blend of acceptance and commitment therapy with nonviolent communication, which is another technique or methodology that I really enjoy. And this is a self-empathy practice for working with strong self-judgments. So if you're sitting with a harsh criticism of yourself that just won't go away, I'm no good at my job, I'm not good enough in this way, or I'm not organized enough, I'm not attractive enough, I'm not perfect enough, whatever the self-judgment is that's hanging around. It could be triggered by a recent event, or it could be one that just comes up regularly for you. Then I've got a process for you for unpacking it, making sense of it, and bringing more empathy and compassion towards yourself. So I'm going to take you over here to the whiteboard and show you the 4 steps of this self-compassion exercise. So it's a little bit acceptance and commitment therapy like, because the first step, as you can maybe see here on the whiteboard, is when I tell myself. So we identify the self-judgment. So actually the pre-step is figure out what it is that you are judging about yourself. So the self-judgment or the self-criticism. So in this case, I've chosen one from a client I saw this morning. I should be stronger. And she meant physically, because she struggles with health conditions, but this could be emotionally and mentally stronger. Your judgment might be, I should be better at my job. I should be more organized. I should be more educated. I should be smarter. Which we could flip into a judgment like, I'm not good enough at blah, blah, blah. But working with this one, step 1 is when I tell myself I should be stronger. So already we've got a bit of diffusion going on, bit of distance. It's a story I'm telling myself. I should be stronger. Step 2 is I feel. So she said she felt frustrated and angry. And then we went to step 3. Because I need or want. I'm frustrated, she said, because I want things to be easier. These doctors and physios keep telling me I should be stronger, and I'm working really hard because I want relief. She wants a little bit of ease. She just wants life to be easier. And then I said, where do you feel that frustration? And step 4, if you can see it here, is where in the body is that? And she said, I feel that frustration in my throat and in my face. So I'm going to write that up on the board here, throat and face. So that was one iteration. And then we went back to the start. When I tell myself I should be stronger, I feel, she said she felt disheartened. She felt disheartened whenever she was stuck on this self-judgment. Because I need or want, she said, I want nurturing. Instead of people telling me that I should be stronger, I just want nurturance. I'm always nurturing others. I want nurturance. So this was the second need that she identified, was nurturance or nurturing. Where in your body do you feel this? I said. She felt that disheartened feeling in her heart, not surprisingly, in her chest cavity, she said. Then we went back to the start. When I tell myself I should be stronger, I feel, and we looked for another feeling. And she said, I feel hurt. I feel hurt. Because I want or need, she said, because I want empathy and understanding. I just want others to know how much I'm struggling and how much I'm suffering. She wanted compassion. She wanted to be seen. And she said that she felt this yearning for empathy and understanding and the hurt that came out of not getting it, that she felt that in her stomach and her chest. And she started to get a bit shaky. The feeling that came up then was shakiness, and she felt that through her whole body, including her arms and legs. So by the time we got through this exercise, she was teary because she was connecting with her own feelings and her own unmet needs. And she had some insights that she'd been ignoring or denying herself, not conscious of her unconscious stories, unconscious, not conscious. And she started to see that these underlying unmet needs were inherently positive, that there's nothing negative or toxic about wanting acknowledgement, nurturance, relief, compassion, understanding. These are inherently positive needs. And so we started to focus more on believing that she deserved these things to happen. These needs were valid and legitimate, and that she was safe to ask for what she wanted. It was quite a transformational session for her. I use this 4-step self-empathy approach with a lot of my clients because all of us struggle with self-judgment, and all of us struggle with beating up on ourselves and being very hard on ourselves. But as you can see from that 4-step process, which I can put in the comments below if it was difficult to see my whiteboard, we can use our self-judgments as a portal to understanding our feelings and our unmet needs, get more embodied, sort of more in the moment, which requires us to get into our bodies and out of our heads. And in doing so, we are more empowered to ask for what we want. So if you have any questions about this process or self-compassion practice in general, please ask me in the comments below. Okay, until next time, bye for now.